Hello. If you're new, my name is Dr. Olivia. I'm a consultant in the NHS in the UK, and I talk about life as an international medical graduate in the UK. If you've been here before, thank you so much again for all your likes, your comments, your subscription. You've given me some ideas, which is great, and today's video is actually inspired by one of you who asked about the Plab 2 exam. Okay, so just in case you've never heard about it before, which is unlikely, but it's the Professional Linguistics Assessment Board exam. There's part 1 and 2, and you need to complete both parts in order to be able to get full registration with the GMC. It is changing this year. It's 2024, and there's been chats for many years about the Plab exam changes. So now, instead of using the Plab blueprint as the base, you'll be using the MLA blueprint. So it's a national assessment that will be carried out, and everyone, including UK graduates and international graduates, will be judged alongside each other on the same criteria for passing this exam. Okay, so the first thing to note is that if you're doing Plab from May 2024, you need to download the MLA blueprint instead of the Plab blueprint on the GMC website and use that as your basis for studying for the exam. Okay, I will preface this entire video by saying that I may have to take it down at some point. I was offered the opportunity to become a Plab examiner last year, but due to my schedule and how busy things were, I didn't take it up. So I am considering becoming an official Plab examiner this year, and if I do, there is a possibility that I may have to take down any videos related to Plab 2, and that I may not be able to do the personal professional coaching sessions for that particular exam. But until then, we carry on, and I will give you what I think are my tips for this particular exam. So one of the more common questions is, should I join an academy? I'll come back to that in a little bit, but just to go through the basics of the exam, it's 18 stations, 2 rest stations, 16 active either examination or consultation sessions. You have 1 minute and 30 seconds before each station to read your instructions very carefully. And like I will say for every single one of my exam advice videos, that reading is the most important part of any exam. Reading and following instructions. So take your time, 1 minute and 30 seconds, calm down, breathe it in, know that you can do it, and enter the station. Don't forget also to sanitize or wash your hands when entering each station. Again, just very basic things that we would do in our regular medical practice, but because of the heightened state of being in an exam, people may forget. Okay, and what they want to see is that they want to see that you're a natural conversationalist. They want to see that you're making the patient feel comfortable, taking on board what the patient has to say, hearing their concerns, not forgetting to ask them if they have any more questions or whether you've covered everything. They want to see that you're safe, that you've asked for all the red flags, that you've ruled out anything dangerous, and that you'll be safe as a foundation year 2 doctor, so that you've had some experience, but that you're safe to progress to your foundation year 2 level within the NHS. Okay? And they want to see that you're confident. They want to see that you've done this before, even if you haven't, because some of you are taking this exam straight out of medical school, but they want you to pretend sometimes. If you've worked before for a few years, those of you who have, it will be easier for you in that sense. But if you haven't, they want you to formulate a plan. They want you to come up with a differential diagnosis in terms of something that would happen in your everyday medical practice. Okay, and that takes me back to the academies. Having that structure and knowing what to expect in every single station. So there are 16 stations, but there could be hundreds of scenarios. So you may not be able to practice every single one, but practicing as many as possible gives you that ultimate confidence, that boost, that actually this is more familiar to me. Number one, in my clinical practice, and number two, with the fact that I've practiced it with somebody else in a structured environment like an academy. Okay, so knowing what to expect is one of the benefits. The second thing is that you have practice equipment. For example, the mannequins and the arms that you may use to put an IV cannula or draw blood, and you can take those steps in front of somebody else with what will come in the exam, as a form of reassurance. So having the structure, having the equipment, and also being guided along with when you come to do your mock exams and getting feedback from persons who have done it before, I think is quite helpful. Okay, what are the possible cons of being part of an academy? So one of the things that people tend to worry about is, for example, the script. So everybody may be taught in a similar way or have something that they may be asked to say on the exam day or to remember on the exam day. And I think it can be dangerous, because if you forget the exact order of the questions, then that may again throw you back and make your anxiety worse at that time. However, I think that the script is more of a guide in terms of what sorts of questions to ask, in terms of how you would formulate a structured response, or how you would formulate a structured consultation. Once you have your structure in place, then that's the main thing. Everybody may have a slightly different structure that they use, and that's fine. The examiners don't have the structure to say you need to ask for HBC, past medical history, drug history, you need to do it in that particular order. But they want to see evidence that you have practiced and that you have agreed upon a structure within yourself that you will follow. So I think that having a script is not necessarily a bad thing, but trying to stick to a script 100% and not listening to what the patient is saying actively, not taking on board their questions and just trying to go by the script will be detrimental. In the exam, if somebody asks you a question, address it then. If somebody makes a comment about something hurtful, something harmful, show your empathy then. You don't need to show empathy for every single negative thing that a person says, but sometimes if something big is demonstrated, you will have to stop and say, I'm so sorry you went through that, or that must have been difficult. But it doesn't have to happen for every single line. They've come to the hospital and they expect to have a conversation with you in a realistic manner. Okay. Sometimes, if you want to stick to your own structure and somebody has made a comment that's leading you in a different direction, you can say, oh, thanks for mentioning this. We can ask a little bit more about whatever the area is a little bit later on. For now, can I just ask about whatever it is that you had intended to ask about at the beginning, so that you can keep your own structure in your head as you go along the consultation, and that way you're not ignoring what they've said, you've acknowledged what they've said, but you're carrying on in a more natural format. Sometimes if patients go in all different directions and you find yourself going in all different directions as well, it may throw you off a bit. So using those little phrases to redirect and come back may help you as well. Okay, what is the other con about using a academy? Sometimes people don't necessarily agree with everything that is taught at the academy, and that can happen. It may not be 100%, it may not be, and everybody's come from different background. They may have learned to do things in slightly different ways. And even some of the theory, some people may say, well, this is not up to date, so I don't want to do it this way. I will say that even if whichever academy you go to, even if it may not be 100%, in terms of the updated information that you may have, I think overall the information that is given will be enough to help people to pass. Okay. Now, for some people, they may not want to do an academy, and that's totally understandable. If you've had a few years experience already, if you have done an observership in the NHS in the UK, and you have witnessed how people interact with each other, how they carry out these procedures, what they normally request, So if you are more familiar with the NHS environment, then you may not have to, get other instructions from people who have had that experience before. So two of the other common questions are, number one, should I get a study partner? 100%. You can study on your own, but you absolutely need somebody to practice those stations with and just to give you feedback, and you can give them feedback. So I would 100% say always have at least one study partner. If you can have more than one so that you get a variety of people giving you feedback, that's even better. And the last question is, how long should I study for? How long should I practice for? I think that an average of 3 months is good. 2 to 4 months, depending on your work experience, and whether or not you include having a place in an academy, for example, for a short period of time. But I think that 3 months is generally okay. I appreciate that it's a shorter video today, but there are hundreds and hundreds of stations that we could potentially go through, and I couldn't possibly do all of that in a brief video. So I'll leave my email address down below. If you want to chat further about personalized practice or personalized advice, drop me a line. Until then, until next Sunday, take care. All my love, Dr. Olivia. Bye.